must have joined in early, and let us start the question answer session. Before we start the session, I'll just tell you, before I get any questions, I'll just tell you something about the importance of understanding the non-verbal communications. Non-verbal means what the patient does not say. You have to interpret or you have to see from the patient and take out those symptoms. For example, we have seen the symptoms of sleep in our practice, where we say what is the position of sleep, whether the patient sleeps on the abdomen like carcinosin, like calgara foss, like medorinum, or the patient sleeps on the side. Which side more, the left side, the right side? Walaikum assalam, Dr. Abid. And so this is non-verbal, means this patient cannot control it. And what the patient cannot control it, which becomes involuntary, that becomes the innate character of the patient. So it is very important to understand and to interpret the non-verbal communication which the patient is not able to control, but we can definitely see, and it helps a lot in prescription. For example, if you are asking the patient cough symptoms, at the most he would say that is dry cough is there or wet cough is there, expectoration is yellowish, sometimes it is white, sometimes it is greenish in color, and so on and so forth. But some symptoms which are involuntary, for example, if the patient comes and tells you that whenever I have cough, there is perspiration, this becomes important. So perspiration is basically a symptom with which the patient nobody can create that symptom. So this is very, very important. Yeah, so I'll just take the question after some time, doctor. I'll just complete the thought. So you cannot think that now I'll get perspiration, now I'll be perspiring more, or I'll be sweating more. So the non-verbal communication, one is sleep, and second one you must respect it is sweating, the perspiration part. For example, if the patient says that, sir, I have severe migraine. I had a case where the patient had severe migraine, and the patient said that I get perspiration only where I have headache, and that is right side. I ignored that symptom because I felt that was not so important. So we took the whole case, we got the history, and we prescribed the patient some remedies like natramir was given, belladonna was given, with only not so much good result. Now when I added this symptom and I took that symptom, that perspiration on the affected parts, while adding 2 or 3 symptoms, a simple remedy that came to my repeated chart or with Mathemedica was simple Rustox, which I never thought for a case of a severe migraine. So I gave the patient Rustox first starting with 30, then 200, then 1 m, and in a span of about 8 to 10 months of time, his migraine was totally treated with homeopathy medicines. So the entry point of the case was perspiration on the affected part. This is an involuntary symptom where the patient cannot create, or you don't have to ask. It is very easily understood by the patient, very easily told by the patient, because there is nothing more or less than that symptom. So remember, my dear friends, perspiration on the affected part, Rustox, Merxol, Antimtart, Causticum, Cocculus, these are the remedies which are very, very important. I have found in my practice. Of course, there may be a lot of other remedies also. Yeah, Dr. Babel, hello. Good afternoon, Dr. Jyoti. So I was just completing the thought of non-verbal communication. I just completed one part, that is perspiration on the affected part, and that case of migraine was given Rustox. Second part, suppose the patient comes and tells you that whenever I am very anxious, whenever I have to perform something, I am anxious, what to do, what not to do. There's always stress, anxiety, and whenever I am anxious, I have lot of perspiration. Now, anxiety can have perspiration, palpitation, trembling, weakness, lot of things. But if the anxiety is with perspiration, that it becomes a very, very important symptom. And anxiety with perspiration, do think about arsenic, pulsatilla, phosphoric acid, calcarea carb, sepia, and to your surprise, chamomilla also. These are the remedies, whether it's perspiration during or your anxiety during perspiration. So this is a this is an example where you can look for the symptom perspiration during anxiety and you can get the remedy. Of course, in that rubric there would be a lot of other remedies, whatever I can remember I'm telling you. So I'll just take one question. बहुत सर नर्वस सिम्टम वीक हो गया है. See, what first of all, Dr. Abid, you have to see what is weakness of nervous system means what. Weakness of nervous system, there are a lot of other things, but normally I cannot. You have to basically tell me which symptom are there because of weakness of nervous system. Then I'll be able to answer the question better. Okay. ओके हिंदी में डॉक्टर वसीम. ओके, सो हम बात कर रहे थे पर्स्पिरेशन की नॉन वर्बल कम्युनिकेशन एंड दैट्स व्हाट आई वाज एक्सप्लेनिंग. ओके, नेक्स्ट, try not to ask the questions on my WhatsApp so it becomes difficult for me. Good afternoon, doctor. मुझे double vision, if you have double vision problem, make sure that, see, if you just prescribe only because of double vision, there may be hundreds of remedies. Now you have to define that symptom properly. Every time I tell you, how is the vision? You can see the upper part, the lower part, the right side, the left side. And why is the double vision? Whether the problem is in the muscles or in the eyes, or because of overstrain, because of overuse. There are a lot of other conditions that you have to put in your symptomatology so that I'll be able to answer it better. Double vision, you can have lots and lots of medicine, but I can't give you exact remedy for that. Good afternoon, Dr. Vishaka. So I was just telling you something about the non-verbal communication. First we completed the, सर मुझे एक साइड शोल्डर और थाई में बर्स्टिंग सेंसेशन हो रहा है बहुत ज़्यादा. So the question of Akanksha is that she has a bursting sensation on one side of the shoulder. See, if simple, the remedies could be the bursting sensation in shoulder joints, the muscle part is there. You can think about belladonna, macphos, rustox, sulfur, phosphorus, lycopodium. Okay. For say anxiety disorders, if you have with fourth class, then basically you have to take the whole case, why the anxiety and what happens during anxiety. So I'll be able to answer you better. Nervous system कमजोर हो गया, वहाँ चक्कर. See, if you have weakness of the nervous system and you have just a problem only of vertigo and anemia and all, so you can think of some remedies like phosphorus, thiocyanamine, nitramur, arnica, china, and maybe ferrum phos or ferrum metallica, one of the two. Avena sativa, yeah, Avena sativa is a remedy for. You can take Avena sativa also. Yes, you can take that. So let us go forward, and I'll just complete one more. Left frozen shoulder, pain, stiffness, heaviness, weight, in gym few months. Okay. So maybe Dr. Vijay, you must have overstrained your muscle, especially left side. So acute medicines and chronic medicines are different. So left side you can think about spigelia, you can think about calmia latifolia, you can think about, of course, again, guaiacum, you can think about gaultheria, you can think about salicylic acid, and so on. For most important remedy you must think about is rustox, ruta, and belispar. Avena sativa, yes, you can think about. Anxiety में या यू कैन गिव, आप एवेना सेटेवा दे सकते हैं. एंग्जाइटी में फिर फियर ऑफ डेथ क्यों आता है? इन एंग्जाइटी यू कैन हैव एनी सिम्टम. डॉक्टर राजू, आपको एंग्जाइटी में कुछ भी सिम्टम आ सकता है. फियर ऑफ डेथ, फियर ऑफ गोइंग आउट, फियर ऑफ अपीयरिंग इन पब्लिक, आपको कुछ भी सिम्टम हो सकता है. इसी से तुमको उनको एंग्जाइटी बोलते हैं ना. सो लेट अस गो फॉरवर्ड. Avena sativa आप दे सकते हैं. You can give Avena sativa. Next, perspiration. When the patient comes and tells you that there is perspiration, then do ask how is the perspiration. It is warm. Namaste, Dr. Shamil. It is warm. It is hot. It is cold. It is clammy. A lot of other things. For example, if the patient comes and tells you that it is winter time now, there is a lot of symptoms of upper respiratory tract like coryza and coughing. There are a lot of remedies where the patient comes and tells you that, sir, whenever I cough, I have lot of perspiration. So whenever I cough, so perspiration from cough, okay, perspiration from cough. That is again a very, very important symptom. The patient comes and again, whenever I tell you something about the cough, it happens. So you can think about common remedies like bryonia, belladonna, drosera, spongia. But now the patient is coming and tell you that perspiration from coughing. So whenever I cough, I have perspiration. You must think about 4 remedies which I have found very useful in my practice. First is Sambucus nigra, second is sepia, third is hippursa, and fourth is phosphorus. Whenever there is perspiration from coughing. There was one interesting case in my practice when the patient told me that I don't have perspiration from coughing. I cough, and when the cough stops, the perspiration starts. Now, this is again a very, very important defining symptom of the patient's personality and also of the cough. If you open the Materia Medica, there is a fantastic symptom, perspiration from coughing at the end of the paroxysm. You must think about ignitia. I think the second remedy you must think about is arsenic album. But ignitia has given me very good results when the patient says that, bus, when my cough is going to end and then I start perspiration. This is again a very, very important symptom of perspiration. Again, a non-verbal communication. Okay. So let us go forward and Now sometimes what happens, that cough, the perspiration is very exhausting. The patient says that when I perspire, I feel very exhausted, I feel very tired, I just want to go and sleep. That means you have to take that symptom that perspiration is exhausting. Perspiration is exhausting and the patient is tired because of that. Now, exhausting perspiration, again, there are a lot of remedies like syphilinum, Chinasol, phosphorus, Merxol, camphor, bryonia. But then if you again try to define that perspiration, just ask the patient when. So the patient says that I suffered from, simple cough, cold and coryza and acute disease. And after that, I have started developing lot of perspiration. See, such a beautiful symptom the patient has told you. That after acute disease, the perspiration is so much, it is very exhausting. My fever has gone, I am not taking any medicines, I am eating well, but still I have perspiration and I feel very weak because of that. In the whole Materia Medica, there is only one remedy, and that is pilocarpus. And what is pilocarpus? Pilocarpus is the alkaloid of jaborendi, which we use in hair oils and a lot of people use in hair oil. But see the symptom now, that the perspiration is debilitating after acute disease. Only one remedy, that is pilocarpine. Hello, are you with me? Yes, everybody? नेजल पॉलिप वी हैव ऑलरेडी डन. हमने ये नेजल पॉलिप का चैप्टर पिछले 2 या 3 यूट्यूब पहले किया है, तो आप मेरा यूट्यूब देख सकते हैं. उसके पहले कुछ ड्रग्स जो मैं आपको बताना चाहूँगा, कैलकेरिया फ्लोर, सैंग्योनाइट्रिकम, नेगरिफस नट, लैम्ना माइनर, tuberculinum. These are the remedies you must think about. Okay, so please go and see that. Now the patient comes and tells you that, I had a fall on my back and I had the injury in the spine, and after that I suffer from lot of perspiration and I feel very, very tired. So there is a beautiful symptom in our Materia Medica, there is a beautiful symptom in our repertory, that the perspiration is exhaustive, the perspiration is debilitating after spinal injury. And my dear friends, if you go to see, there is only one remedy in that, and that is nitric acid. So again, my request to you is, try to define the patient's symptom properly so that you can reach to a minimum very fast. If you just tell, okay, perspiration debilitating, okay, the symptom is good, but there are 50 to 60 to 70 remedies in a mater medica. And because we have been taught that Muxol is very, very important, there is a lot of perspiration. First of all, we give Muxol, and then if it does not work, then we say, oh my God, now what to give? So it is very important to define the perspiration. That is very, very important. So, and of course, the perspiration, the odor is important. If the perspiration is debilitating and very foul, then the remedy becomes crocus sativa. So this is a very, very important, again, a non-verbal communication which is important for prescription. I'm just telling you the simple part whenever the patient perspires easily, One more thought before, if I have any questions. Okay, yeah, I have a question. Sir, emphysema with mild renal failure and hypotension. Yeah, so again, a very interesting case, and I always tell that you have to be lucky to get such a case and such a chronic cases, so that you can always give patient good relief and you also feel satisfied, that you have done something for the case. Whatever I can understand from the question, not going into the detailed case taking and all, 3 or 4 remedies that come to my mind. First is anti-Mars. Please go home and read anti-Mars, very important. Second, do think about phosphorus. Third, again, do think about Muxol. And fourth, think about calcarea carb. There will be a lot of remedies if we get the whole case, but whatever I can understand from the question, I'm just narrating you the remedies. So next, see, if you are happy with the answers and if you are understanding what I want to tell you, just give me some thumbs up. I always say, so that I know that I have to proceed and move on to the next question or a next thought of mine. Otherwise, I will try to answer it better. So please give me some, indication that you're understanding, okay, so that I can move forward. Now, one thing also, whenever there is perspiration, the first thing, sometimes, we have perspiration because of fright. You have to, you have to perform in front of public, you get perspiration. You have to give a webinar, you get perspiration. You have to go to a doctor, you get perspiration. You have to go to see a girl for marriage, you have perspiration. So whenever there is fright, and this is a very, very common symptom you will encounter in your practice, perspiration from fright. This is a very, very important thing. Again, a non-verbal communication. We dealt with, the perspiration debilitating and perspiration, during anxiety. And now I'm telling you perspiration from fright. This is again a very, very important symptom, because fright, again, if you have seen my YouTube videos, I'm posting the rubrics and all. So fright, sadness, anger, these are very, very common human, nature, and everybody comes across this very frequently in life. So this patient remembers very clearly in his mind. Okay. I'll just take one question. Stone in gallbladder can be treated with homeopathy? Yes. And I have lots of cases where I have treated stone with homeopathy, and it has got good results. Of course, there are some cases where I could not get the results also, but we have cases where we have removed gallbladder. So perspiration from fright. There are some remedies which are very, very important and which are very, very 3 marking in our practice, which we have seen. First is, of course, belladonna, calcarea carb, chamomilla, phosphorus, and opium. These 4 or 5 remedies I have seen in my practice. These patients have lot of perspiration from fright. If they are fearful, if they fear, they start perspiring. And just ask the patient about perspiration, just ask them about, kya pasina aata hai kya? Haan, yeah. Whenever I feel frightened, my body starts perspiring. And this becomes again a very, very important entry point of the case, because again, this is a non-verbal communication. The patient does not have to think and answer. He knows clearly that whenever I am frightened, I am afraid, I get perspiration. So these symptoms again are important in your case taking. So I'm just taking the simple parts, where you'll be able to ask the patient and prescribe the remedy. Now, A patient comes to you, with a stomach problem. I'm telling you, maybe in the early days of practice, there's a lot of bloating in the stomach, lot of gases in the stomach, lot of eructation problem, and the patient has lot of discomfort. Normally, we see remedies like Lycopodium, China, Carboveg, Iris were very commonly indicated. Okay. Now, sometimes it becomes very difficult to differentiate between Carboveg and China and Lycopodium. Of course, in books, there are symptoms like gases in the upper abdomen, in the lower abdomen, in the whole abdomen. But you will also appreciate that when the patient comes to us and he says, "Sir, I have gases problem here." Sometimes it goes here also, and sometimes here also, sometimes here also. And it becomes very difficult to judge what is the patient trying to tell us in the upper abdomen or the lower abdomen or the whole abdomen. And then it is difficult for us to prescribe. I'll just take one question. Hi sir, it is necessary to have restlessness and symptom if other symptoms are matching? No. If the patient, restless leg is because of cerebral irritation. So if it is not there also and rest of the symptoms are matching, you can give zincum metallicum. No problem. So I'm just telling you something about stomach problems. Do you face this type of problem where it is difficult to differentiate between Carboveg, China, Lycopodium? What the patient is telling? Gases, bloating, eructations. He keeps on telling gases and eructation. It is difficult for us to, differentiate between remedies. Of course, I had this problem in my early days. Now, if you ask the symptom of perspiration, the patient tells you that, sir, whenever I have, a stomach problem, I have perspiration. And now this is a very important symptom the patient has told you. Apart from the gases part, which is for you difficult to differentiate, now the patient has told you, sir, whenever I have gastric problems, I have lot of perspiration. And my dear friends, if you go to the repertory or Matermedica, Carboveg is the remedy where the patient says there is perspiration in gastric complaints. So it becomes very easy to differentiate between Carboveg, Lycopodium and China. There are other few remedies also where the patient says there is perspiration with gastric complaints. First is Carboveg, second is Natramure, third is nitric acid. There must be other remedies also, but these are the remedies which I remember because I have used this with very good results. Carboveg, Natramure and nitric acid. So again, this becomes very important in our practice. One more thought, if there are no questions. Yes. So one more thought, it comes to me. Sometimes the patient comes and tells you that, sir, you see my perspiration, it is so hot. Garam. The perspiration is hot. And I'll just take one question. Sir, testes pain and mild abdominal pain, CCT abdomen is void and USG scrotum is void. What can be? No, if you're asking me the diagnosis, I'll not be able to tell you that, but testes pain, mild abdominal pain, if you want to prescribe some remedy, there are few remedies which are very important. You can think about clematis, you can think about rhododendron, hemamelis, sulfur, phosphorus. Whistling sound and breathing in patients of sick, suggestion please. See, whenever you are treating a patient of CKD and the patient comes to you, of course the patient normally comes to us after a lot of allopathic treatment. The patient comes to us when the creatinine is very high, 4, 5, 6 and all, and he comes to us and says, I have heard that homeopathy can cure renal failure, so I have come to you. He has come because the allopathic doctor has told him now there is no option, you have to put a fistula and prepare for dialysis. Then the patient comes to us. So if the patient comes to us in this situation, believe me, he is already suffering from fourth or fifth stage renal disease. There's a lot of retention of water in the abdomen, and that goes up, and that's why there is a lot of wheezing in the chest. It pushes the diaphragm, so that there's a pressure in the lungs, and because of that there is a lot of wheezing. The patient comes with anuria, the patient comes with constipation, the patient comes with loss of smell and loss of taste, and is not able to eat food because the food smells very bad. He cannot eat food also. This is the stage where the patient comes to us. So sometimes these symptoms become very common symptom in most of the cases of CKD. But if the patient is adamant that please treat my wheezing and rest, everything is fine, no problem, then you have to think about some medicines. When I had joined my senior doctors and all, and in my practice also, I have seen few remedies which are very helpful in just treating the wheezing, and that would be only temporary, because if you cannot treat the CKD, that wheezing will always come back again. You have to think about first remedies: entim ars, entim tart, kali carb, phosphorus, common remedies. If infrequently used remedies, you must think about balsam peru. Think about balsam peru is one, and think about eridiction and yerba santa. But I would still feel that you should basically prescribe on the CKD the whole constitution, because as the patient starts urinating, the pressure goes down of the fluid retention, and everything starts getting better. This is my opinion. This is what I do in my practice. Still no arnica 1m dose clematis. Okay, you have given the comment. So those एक बात ध्यान रखो, Amit. Just give me few more symptoms in relation to the patient's constitution rather than of disease, so I'll be able to help you better. 76-year-old male with PSA and 5.97 with mild dribbling of urine after passing urine, no burning and no pain. Yeah, very nice. And these are very common problems, where the patient comes to us, the PSA is very high. I had a case where the PSA was 1800. I had a case where PSA was 1200. So, and these cases are very I would not say easy to treat, but sometimes if the symptoms are there, give LM potency in repetition. I sometimes have to repeat LM potency, and it gives a very positive results. I can't use the word magical, but they're very good results. So in your case, yeah, no burning, no pain. So whenever the symptoms are there in your clinic and there's no burning, in case where the symptoms are expected, still there are no symptoms, then that is a very important symptom, Dr. Disha. I hope you understood what I want to tell you. When the symptoms are there to be expected but they are not there, in that case, that symptom is the important symptom. In your case, it is present. Think about conium, think about phosphoric acid, think about Laurus rhesus, think about entim crude, and give them in LM potencies and repetition, and you will get good results. Of course, add to it few more symptoms, and then you can prescribe the remedies. Sir, mother suffering from COPD with coronary blockage hypertension with medicines. Dr. Amar. Yeah. See, Dr. Amar, I know if the patient is our relative, especially father and mother, it becomes very difficult for us to treat. See, COPD with coronary blockage and hypertension. In this case, I would suggest that please take the whole case. Till that, for COPD, you can think, see, beryllium, plutonium. For coronary blockage, you can think about cratagas in LM potency, osteophanthosol, again, Arjuna also. This would be a very acute prescription, but if it's your mother, please take the case before giving the medicine. Medicine, if one person talks foolish, not vulgar but abusive, if everyone laughs on his activity. See, if the patient is foolish, you can take, if everybody is laughing in his activity, you can take one rubric childish behavior and you can get the remedy. Acid reflux treatment, no pain in the abdomen. Acid reflux normally does not have the pain, it comes up. Make sure to first rule out the patient is suffering from hiatus hernia. In case of hiatus hernia also, you get a lot of acidity. Okay. Symptoms are mild. No, I just want some mental symptoms. Yeah. Medicines, if 1%, I told you about, no? Excellent. Thank you. Yeah. So one more. I think question has scrolled up. So different chamomile and platinum in ear symptoms. Frankly speaking, if you want to ask me chamomile and platinum ear symptoms, I have to think and answer, because normally we use I use chamomile or platinum more in relation to the mind symptoms, not in ear symptoms. So it's already half an hour up. In next YouTube, I'll definitely tell you the difference between those two. Okay. So thank you so much. Thank you so much for joining, and I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday. Goodbye.